Hello everybody, my name is Ahmed Mirza. I'm a family nurse practitioner, and today I'd like to talk about 5 things that I wish I would have known before starting nurse practitioner school. Number 1 is the job market. I wish I would have had a better idea of what the job market was. I went into a family nurse practitioner program because that is the area that I was most interested in, and I didn't really think much of what the job market was. I assumed that, just similar to being a nurse, that once you graduate, the jobs will be everywhere. You can find a job anywhere, no problem. I did rely a lot on what peers were telling me. The info that I was getting from recent nurse practitioner graduates, family nurse practitioners, were that they were getting jobs right away, and this was specifically to the ER where I was working. They got jobs right out of school, had good pay, and I just assumed that that's the same thing that's going to happen to me. I didn't really look into the job market, whether it was saturated or not. At the time, nobody was really talking about a saturated NP job market, so it wasn't even a thought that I was having. But if I were to go back in time, I would really sit down and decide, okay, what are my interests? What specialties of nurse practitioner do I like? Do I like psych? Do I like acute care, family, neonatal, whatever it is, midwifery? And then take a look at the job market. Where do you live, or where do you plan on living? Look at what the postings are, look at what the requirements are. Some kind of red flags that you would see is if all the job postings are requiring 2 to 3 years of experience, or if the job postings show a whole bunch of applicants. Then those are kind of red flags that probably indicate that an oversaturation in that market. And that doesn't mean you should not go into your preferred specialty, but it's just something you should consider. So if you're on the fence of, say, doing family or doing psych, and then you realize, hey, the job market for psych is actually much better than FNP, that might be a deciding factor for you. Number 2 is having a realistic pay. So I had this expectation that as soon as I get out of school, I'm not going to take anything lower than $120,000 a year starting full-time pay. Well, that's not really the most realistic expectation, especially if you're a family nurse practitioner. I'm now sure there are some nurse practitioners that do make 120 or possibly more, like psych, some ER nurse practitioners, acute care nurse practitioners. But if you're a family nurse practitioner, I wish I would have had a more realistic expectation of what my starting salary would be, especially in the outpatient world. You could better expect anywhere from $80,000 a year to, on the higher end, $105,000 for your first couple of years as a nurse practitioner. Don't expect you coming right out of school making, 120, 130, 140. Like I said, the only outliers are those specialty areas like ER, acute care, neonatal, maybe even psych, where you can, right off the bat make above $100,000. But in general, if you're a family nurse practitioner, you need to be okay with your first job making $80,000 right out of school. So I wish I would have known that. I had kind of higher expectations. Number 3 is the politics of the nurse practitioner profession. And this is across the board of all nurse practitioners, so it's not really specific to family nurse practitioner. But in my opinion, I was thinking that, about half the states in the US have full practice authority. It looks like this is the trend that we're leading to. Probably in another 10-15 years, the whole US is going to have full practice authority. And as a family nurse practitioner, I can possibly go and open up an urgent care or family practice, and I'll be all set. As I started practicing more as a nurse practitioner, I realized that the politics is really deep. It's not just about full practice authority. Yeah, having full practice authority is very political and is a great stepping stone, but there's other obstacles that we have to deal with. For example, even if you have full practice authority, some of the major insurance companies still give you a hard time when you try to credential your own practice. A lot of times, even if it's a state that's full practice authority, they still require a collaborating physician to get you credentialed with that insurance. If that's an issue and you don't have a collaborating physician, say you're full practice, then you may not be able to get a contract with a major insurance company. Then you can't see those patients and you lose out on that. Also, there are certain states, like right now I live in Michigan, and there's this weird law that nurse practitioners can't open up a PLLC, a professional LLC corporation, to start their own clinic. So we're not even recognized as a learned profession that would allow us to open a clinic. It would have to be someone else that owns the clinic, and then we can practice there. Even though in Michigan, We don't have a full practice authority, but we can pretty much do everything within family practice except prescribe controlled medication without a physician collaboration. So the politics are pretty deep. I don't think that's ever going to end. In general, the nurse practitioner profession, political wise, is heading in a good direction. We'll just kind of have to see how it plays out with the amount of nurse practitioner programs that are out there, and the amount of saturation, whether that's going to hurt the profession or make it better. We'll see. Number 4 is the stress. And this is something that I didn't really expect being in school and before starting school, is the amount of stress that you feel, especially as a new nurse practitioner. Usually you'll have a few years under your belt as an RN, you're comfortable in that role. You work, you collaborate with your doctors, they put in orders, you kind of check them, and then you go about your day. When you become a nurse practitioner, the whole paradigm of how you work and how you think completely shifts. Instead of being a bedside nurse where you receive orders, you're the one kind of figuring out what's going on. You're placing the orders, you're making treatments, you're the ultimate person that's responsible for the care of that patient. And that is a lot of stress on your shoulders, especially as someone new. You're still not 100% confident in your skills. You're still having to look up a lot of things. You're still asking a lot of questions. You doubt yourself so many times. You second guess yourself. And it's just really stressful as a new provider, and that's across the board in all specialties. It's going to be stressful. I really wasn't expecting that. Other stressful thing as a nurse practitioner is right after school, usually as soon as you start working, you hit the ground running. So you're expected to perform usually on day 1 of working. They may give you a week, maybe a few weeks of orientation. If you're lucky, you'll get a couple months of orientation to kind of get your feet wet. But after that, you hit the ground running. So if you're a new grad, within a couple months, you're expected to perform kind of full scale, seeing a full set of patients. And that is stressful. And as nurse practitioners, most of us, we don't have that residency period like physicians that allow us time to kind of get our feet wet, learn kind of the ropes of medicine, get comfortable. We got to start working right away, so that can be stressful as well. But I will say that it does get easier as you gain more experience, you gain more confidence. You're kind of set in your ways of being a provider. You're used to a set of medications that you prescribe, that you deal with, and you get a lot more comfortable, and the day gets easier and you get less stressed. So that does improve over time. Number 5, I wish I would have known how important a fellowship, 1-year fellowship training would be. When I was in school, nobody really was talking about fellowships. I never had it in my professional plan, but when I was getting near graduation, I was looking to work in the emergency department, and in the interview, the medical director asked me if I wanted to do a fellowship, emergency medicine fellowship. This was a 1-year fellowship, about $50,000 to $60,000 salary, but it's essentially kind of like a residency, but it's 1 year, and you get trained. You work side by side by another provider. You see a lot less load of patients. There's a lot of didactic and learning experience. It's just a wonderful 1-year experience that once you're done, then you're ready to hit the ground running at full speed. You're confident, and you feel very good about yourself. At the time when I was asked to do that, I've never really heard of it, and my initial reaction was, doing 1-year fellowship at $60,000, I don't want to do that. I just want to start working, and I don't want a substantial pay cut from what a nurse practitioner can make. Why would I do that? That was my reaction. But now in retrospect, I think about it. If I would have done that 1-year fellowship, it would set me off really well. Kind of moving forward, especially working in a difficult specialty like the ER. A lot of those issues that I talked about, the stress, the saturation of the job market, having a hard time finding a job, a lot of those issues could have been solved of just doing a 1-year fellowship. You apply to the fellowship program a few months before you graduate. If you get accepted, right after graduation you're going to start this fellowship. So it solves the problem of not finding a job. It solves the problem of that saturation, and then it solves a lot of the stress problem because you're not expected to see a full set of patients right away. You're in a teaching like a student position, so they're there to teach you, and you kind of work slow. So definitely encourage doing a fellowship program if is available in your area and if it is something that you can afford. I recommend kind of setting it in your plan early so kind of you can work your life around it. But those are my 5 things that I wish I would have known. Despite all that, I still love what I do. I probably would not change my decision, but those 5 things, could make a difference in someone's decision of being a nurse practitioner. Maybe it'll make a difference of you wanting to change a specialty or do a different specialty or decide whether family or psych or whatever it is that you'd like. If you enjoyed this video, give me a big thumbs up, subscribe for more content in the future. Check out these 2 videos that I made earlier, and we'll talk to you later. Bye.